Namaskar. I'm Shubhra Sinha and I'm presenting the fourth lecture of Module 3 of Stress Management course. This lecture talks about dealing with adjustment disorders. Dear friends, in earlier lectures, we have talked about adjustment, maladjustment, and the severe maladjustments that may result into diagnosable adjustment disorders. Moving on in this series, this lecture is devoted to the treatment and handling of adjustment disorders in order to make the life better of those who suffer from severe kind of maladjustments. However, all these techniques are also useful for people who do not suffer from any kind of adjustment disorders, but of course, frequently face challenges with respect to making adjustments to different conditions in various domains of life. So, today we are going to have a quick recap of causes and symptoms of adjustment disorder. As we have already talked about them in detail, here I would be very brief in repeating these things. Then we will talk about the diagnostic criteria of adjustment disorder, types of adjustment disorder, and finally, the interesting section which follow this would be the therapeutic techniques for handling adjustment disorders. Let us proceed with the following details. First of all, as we know that the causes of adjustment disorders can arise in any domain of life, may it be personal, social, professional, or any other. Any stressful events that take place in our life, personal losses, major transition in life like transfer to other places or switching roles in professional life, changing disciplines can be a major transition, or simply entering into married life can again be a major transition of life. Causes of maladjustment can also come from relationships that we share with other people. Relationships which we have by birth or relationships that we develop with time. Symptoms again include all the three areas of cognition, emotion and behavior. So cognitive impairments can be seen, emotional disturbances may be there, and behavioral problems are definitely there in people suffering from adjustment disorders. This is the diagnostic criteria, which says that there must be an identifiable stressor in the life of the person with which the person is struggling to make a balance. Then, from the induction of a stressor, within 3 months, the person must develop various cognitive, emotional, and behavioral symptoms which are overwhelming to an extent which can make the person dysfunctional, or the person can experience significant problems or disturbances in carrying out the daily routine. Then, another condition is that all these symptoms must subside or vanish within 6 months from the removal or elimination of the stressor. If these three conditions are satisfied, we can call that the person is suffering from some kind of adjustment disorder. One more thing is the response or reaction to adjustment problems should be disproportionately high as compared to the actual intensity of the stressor causing maladjustment. The behavioral symptoms and the emotional symptoms, as we discussed, should mark distress and significant impairment in daily life. Any individual who is diagnosed with an adjustment disorder can demonstrate excessive emotional or behavioral response in order while responding to very normal or minor changes in daily life. All these things suggest that the person suffers from maladjustment. If you remember, I referred to different types of adjustment disorders, which goes like adjustment disorder with depressed mood, adjustment disorder with anxiety, adjustment disorder with mixed anxiety and depressed mood, adjustment disorder with disturbance of conduct, and finally with mixed disturbance of emotions and conduct. The recognition of adjustment disorder as a clinical condition underscored the importance of effective adjustment mechanisms for mental health. These are the types we have just talked about, and I have also included a category called unspecified here, which shows a condition where the person suffers from severe maladjustments, making him suffer a lot in his daily life, but the symptoms cannot be fit into the previous five categories strictly. So, in this condition, the person may be showing a little bit of all conditions, the symptoms of all conditions mixed together. So, that is why this category is called the unspecified one. Now, here goes a little description of each type of adjustment disorder. For example, if we talk about the adjustment disorder with depressed mood, it is characterized by overwhelming feelings of sadness and hopelessness, that nothing can be better in future also. I can't do anything to improve the situation. I have nothing in my hands. If it exists with anxiety, it involves nervousness and difficulty in concentrating or thinking about the issues which are causing maladjustment. The mixed anxiety and depressed mood type of adjustment disorder showcases the features of both. That means the person is having anxiety as well as depressed mood. Disorder with conduct disturbances means people show behaviors which may include fighting or recklessness at public places which are considered inappropriate. So, unsocial behaviors or sometimes antisocial behaviors of mild level can be seen in people suffering from this type of adjustment disorder. Then there is a mixed type where emotional disturbances are found along with the conduct related problems. And finally, the unspecified category, which may include symptoms from any or some of the categories described above. Coming to the important part, which talks about handling adjustment disorders or solving the maladjustment issues with people. This is something very important. Talking about problems and its type doesn't give an insight into its solution, whereas solution must be highlighted so that not only the people who suffer from adjustment disorders can be benefited, but also those who are at a higher risk of developing such problems, or maybe individuals who are perfectly normal and functioning at a high level can also be pre-equipped with certain strategies to deal with such situations which may arise in future. So, therapy is the common component of treatment for people who suffer from adjustment disorders. What happens that in certain conditions, medications are also given, especially if the person who has developed the disorder is undergoing high levels of anxiety and depression, which may hinder with the treatment process itself. So, medication is essential to suppress those disturbing feelings so that the person can focus on resolution of the problem. So, the common therapies available for treating adjustment disorder include cognitive behavioral therapy, problem solving therapy, interpersonal therapy, supportive psychotherapy, family therapy, group therapy, and pharmacotherapy, including medications. Let us go through them one by one. The first is the cognitive behavioral therapy. This particular therapy basically focuses on identifying and modifying the negative thought patterns and the maladaptive behaviors associated with the stressor. It equips individuals with coping skills to manage distress and problem solve effectively. For example, uh, if there is a problem related with the job, as we all see that in recent times, during COVID and after COVID, there's a tendency of multinational companies that they are downsizing. So many people, many professionals are losing their jobs. When a person loses his job, this comes like a trauma in the life of that person. So, in this situation, it is very obvious the person would suffer from some kind of emotional disturbance or adjustment problems. This is very common. But what happens if the person starts thinking that I will never be able to recover from this situation? Nothing is going to be okay in future. What will happen? Continuously thinking about the negative outcomes that may happen due to this situation. This will worsen the situation. Instead of that, if the person receives cognitive behavioral therapy, the therapist would help him thinking about the situation in a more positive and constructive way, taking a more balanced perspective. Taking a more balanced perspective means we are not denying the sad part of the current situation. Of course, the situation is challenging. It has come with so many consequences which may be harmful for the person. But at the same time, CBT asks the person to think of the potential solutions of the problem. CBT asks the person to believe in the caliber, to believe in the competence and skill that he or she has, and her ability to find out a new job. By the time the person can be asked to think about alternative financial resources or activities in which he or she can keep himself or herself busy with. Similarly, when it comes to problem solving therapy, it primarily focuses on systematically addressing the stressor by breaking it down into manageable steps and developing coping strategies for issues that cannot be changed. Means there must be an identifiable stressor in the life of the person. Once the stressor is identified, the client is asked to think about the stressor by breaking it into small piece of problems. For example, if a person is overworked, so many responsibilities are there. The person is carrying out multiple roles at personal and professional front. He or she may develop an adjustment disorder, not knowing how to carry out or perform so many responsibilities with a basic level of satisfaction, with a basic level of perfection, whatever the person has set for himself. Now he or she may ask to analyze the problem, to split the roles into different areas, into different responsibilities, and then think what are the responsibilities that must be borne by the uh, person himself, and what are the responsibilities that can be shared with others, and the person can come into the supervisory role. So by doing this, the problem will become easier to deal with. Moreover, if the situation cannot be changed, we can also look into the aspects of the individuals that can be modified in order to uh, make adjustment with that problem. So maybe the person can acquire some newer skills, the person can learn how to use technology while carrying out certain tasks, which may save the time stipulated for each activity. The third therapeutic approach is the interpersonal approach. Relationship is a major domain where problems develop. Now, these problems can be an antecedent for adjustment disorder, as well as relationship issues can be a consequence of an already existing adjustment problem. If I'm not well adjusted at one place, my irritation, my frustration, my anger, my hopelessness is simply being generalized to my relationship at home or in other social areas also. So, interpersonal therapy is very good if the adjustment problems are due to relationship management issues, or adjustment problems have highly impacted the relationships of the person. Here, the therapy directly work on improving the interpersonal relationship and inculcating more and more social skills into the client. Then comes the supportive psychotherapy. This approach simply provides a safe and empathetic environment for individuals to discuss their feelings and experiences related to stressor. This approach helps them to feel understood and validated. This is basically an essential component for all kind of psychotherapies we practice. But even if we do not go into the intricacies of the therapeutic process which belong to a particular type of a school, and simply provide a supportive environment for catharsis, where a person can open up, where a person can tell about his feelings, his experiences without being judged. Only this part can bring miraculous improvements in the state of the client. That is why supportive psychotherapy is also considered a separate technique to deal with adjustment disorders. So, this may be the primary thing that we can do. This can be done within family or with friends or with any other person who is significant in the life of the client who is suffering from adjustment issues. Next is family therapy. Now, when the stressor impacts the family system or the family suffers from the consequences of adjustment disorder, family therapy is very useful. Rather, I should say, it is essential to involve family in the therapeutic process. Because if we do not involve family members, they may fail to understand the condition of the client. They may take his or her behavior as being intentional and indifferent towards them, and they will not be in a condition to provide the required support at the appropriate time. So, inclusion of family is very essential. When you include family members, they get to understand the situation better. It also improves the communication within the family and improves the support that the client can draw from the family members. This also helps other family members to feel better by realizing that whatever was happening to them was not intentional, rather, it was a symptom of some other problem. Improving the overall quality of relationship among the members. Coming next is group therapy. Group therapy involves working with other people suffering from similar problems. When we sit with people who suffer from similar problems or who have experienced the same kind of feeling before or right now as we are doing, this creates a sense of belongingness. And also, it gives a reassurance that I am not the only one having such kind of issues. There are many other people. They are also dealing with such problems and still not giving up. So, why should I? This is a kind of moral support. This is a kind of reassurance or a sense of belongingness that can motivate the client. And this motivation is very essential to deal with the adjustment problems. Moreover, when the person sits with the peer support group and discusses the things with them, it gives an opportunity to share experiences with each other, and it can benefit the client from the experiences of others, from the strategies or techniques they have used to solve their problems. This greatly helps individuals to recover from adjustment issues. Here comes pharmacotherapy. Pharmacotherapy means a therapy which include medication, or in simple words, prescribing medicines to overcome the current emotional and behavioral problems of the client. So medication is not typically the primary treatment for adjustment disorder. It means that whenever a person comes with adjustment issues, the therapist must not give him or her medicine in the first session itself, that okay, you are suffering from anxiety, take the drug, eat it up, and you will be fine. This should not be the approach. Initially, we should try different kind of therapeutic techniques we discussed. But if we find that the person is overwhelmed with anxiety or depression or nervousness, the level of anxiety or depression is so high so that the individual cannot effectively participate in the therapeutic process, then it becomes necessary to administer drugs. Usually, these drugs are given for a limited period of time and in low doses. Common medications that can be used are anti anxiety medications for short term relief of acute anxiety originating from adjustment problems, sleep disturbances, and the other category of drug that can be used is antidepressant if the adjustment disorder also includes the feeling of sadness and hopelessness. We can administer antidepressants to improve the symptoms. However, with antidepressant, there is a problem that they have a slow onset of action. Means if you start a drug, it will take some weeks before it show its impact. Similarly, with anti-anxiety drugs, there is a problem that they may cause dependency. Dependency means the person can develop an addictive type of behavior. He or she can get addicted to the drug. Without taking the drug, now the person is not able to sleep, especially if we are offering drugs to treat insomnia. So, due to their side effects and due to the allied problems, we usually keep the administration of drugs to a shorter period of time, and the predominant part is taken by the psychotherapy instead of pharmacotherapy. Before we get into the therapeutic process, or along with the therapeutic process, or once the therapy is terminated, there are some other strategies that can help the client a lot. For example, we can have some self help strategies or some coping strategies that can be tried by the individual himself or herself. For example, building a strong support system is one very effective coping strategy. So, if we sit with friends and the family members and we talk to them and we talk about our problems, our emotions, the difficulties that we are facing, we can feel less isolated. We are not all alone in this world. Moreover, we can be benefited with their wise counsels. Then, stress management techniques can also help. For example, we can learn deep muscle relaxation or we can learn breathing exercises. These exercises can help suppressing the activity of sympathetic nervous system and the HPA axis, thereby controlling the release of catecholamines and cortisols and bringing the body back into the healthy state. So, learning these stress management techniques is also very important. We can also adopt a healthy lifestyle. For example, regular exercising. Whatever exercise we feel like, it can be simply walking for half an hour or doing a little bit of jogging or maybe cycling or any other kind of exercise. Eating healthy food instead of going for junk food or very high calorie food, we can go for healthy food. Then taking sufficient sleep, 7 to 8 hours daily, and reserve some of our daily time for anything that we really enjoy doing. It could be painting, listening to music, doing some gardening, or trying a new recipe in our kitchen, or simply sitting doing nothing. If we enjoy this me time, this can also help reducing the stress emerging out of the adjustment issues. Then, practicing mindfulness is something very important. Mindfulness means focusing on what you are doing right now instead of being engaged with the future thoughts or past experiences. So mindfulness practice and yoga can be very helpful in controlling the stress levels which emerges due to adjustment issues. And finally, maintaining a structured routine is important. Instead of doing whatever we like at any point of time, we must develop a structured routine which can guide us what is to be done at what time. Our sleep time, our waking time, then what we do after waking, how do we carry out our day, the hours which we schedule for our professional work, the hours that we reserve for grooming ourselves, or the me time, everything should be structured in our daily routine. This really helps people a lot by reducing anxiety of missing out something important or due to suffering from very tight timelines because we have wasted our time in something redundant, ignoring the important aspects. So these kind of issues can easily be avoided if we maintain a structured routine. So this is really helpful in reducing the stress and adjustment problems. Some other techniques include journaling. Journaling means writing about your problems, writing about your feelings. So, if you write it down on a piece of paper, you need not show it to anyone, but simply by writing down, it gives you a way to release your pent up desire, that too in a safe way. Nobody is going to read what you have written. So there is no question of evaluation or no question of, assessing your character depending upon your inabilities or ineffectiveness in handling some important issues. So, journaling is a safe way to release your pent up emotions. It is a safe way to reflect upon things. You write it once and then you go through the description once and twice. You may develop a new insight. So, it is again a very important technique. Having a positive mindset, that means looking at the positive side of every situation. We say that every dark cloud has a silver lining. It is the same kind of thing that apparently the situation is not very good for us, but at least it gives me an opportunity to learn new set of skills, to reorganize myself, to restructure my daily routines. So that can be helpful actually. So having a positive mindset, looking at the positive side of everything we experience, help us a lot in coping with the situation. And finally, one must be very careful in not adopting maladaptive coping mechanism. What happens that whenever we go through stressful situations, we try resort in activities which are harmful in long run. For example, some people can develop a habit of smoking or drinking alcohol, or they may start taking drugs, or they can simply withdraw themselves from everyone around. So these kind of things actually do not help in solving the problems. They may provide a temporary you can say escape from the situation, but in the long run they are going to add to the problem and the situation will be aggravated. So one must be very, very careful in selecting the techniques, the coping mechanism, and must avoid the maladaptive coping patterns altogether. So, this was all about today's lecture. Let us have a quick recap. So, in this lecture, we talked about the causes and symptoms of adjustment disorder, various types of adjustment disorder, including the unspecified category. We talked about the diagnostic criteria, which says that there must be an identifiable stressor and the symptoms should be very pressing, causing significant impairments in the daily life of a person. They must emerge within the 3 months of the induction of the stressor, and they must vanish within the 6 months after the stressor is gone. Then we also talked about various psychotherapies that can help improving the situation, including pharmacotherapy means taking help of medication in reducing or controlling the intense feeling of anxiety and depression if they are present in people suffering from adjustment disorders. And we also talked about a number of self help strategies that we all can use so that we can keep ourselves mentally healthy. These are the references and recommended readings where you can find details of the things I have mentioned. Thanks a lot for your kind attention.